Did you know that our brain consists of 100 trillion neural connections? That's a huge number. And imagine where you have to need to diagnose severe chronic diseases such as brain tumor, Alzheimer's, and multiple sclerosis. The most important element that the doctor has to be provided with is accuracy. But let's take one step backwards. Let's assume that we have a patient who suffers by headaches. An MRI doctor probably suggests an MRI exam. The MRI exam information are being stored to the hospital's servers. Then the doctor downloads the MRI information in order to apply the image processing on a workstation with a pre-installed software platform. The main issue is that the current software solutions, they lack of accuracy. They cannot achieve more than 60 and 65% in terms of accuracy rate in the 3D reconstruction of the nerves of the human brain. tomoTECH solution can achieve a 90% accuracy rate in the 3D reconstruction of our nerves. So what does it mean? What tomoTECH does? tomoTECH develops advanced software, brain MRI software for 3 different MRI exams: diffusion MRI, perfusion MRI, and functional MRI. So when we talk about numbers, 65 versus 90%, are they just numbers? No, they're not. In order to prove that, we conducted a comparative study with one of the major software applications in the market. And we can see now, we observed that our solutions are extremely close to what we anatomically know about the human brain. So tomoTECH solution, tomoTECH software can be characterized by cloud technology in terms of the service provision. It is usable and flexible because you can use it regardless of the device. It's a pay-per-use pricing model in terms of the volume of exam that each client needs and operates on a monthly basis. So let's see an example, a really quick example about what tomoTECH's prototype does. Well, here you can see that we have a selection. We are selecting in the center of the brain the corpus callosum. We want to see what types of nerves, neural connection are passing through this specific area. In order to do that, we're selecting the area, we apply the fiber tract, and now you can see, in a moment, the 3D reconstruction of the nerves of the human brain. It's a model that it can be rotated, zoomed in, and zoomed out. It's a really useful tool for the doctor to diagnose a disease. In terms of the market, there are being executed 100 million MRI exams annually. 30% of them are being conducted in terms of the brain and the neck. In terms of a value of the market, it's around $1.5 billion. For us, we want to expand on 5 main country markets: Germany, France, UK, Turkey, and the US market. Those 5 countries, they valued at around $1.1 billion. So how do we go to the market? Basically through direct sales and also collaborations with distributors in the national ones and domestic ones. But also we seek for a non-exclusive collaboration, strategic alliance with one of the major MRI unit manufacturers. We also provide free of charge the basic version of our software to universities in order to increase brand awareness. Who pays? Anyone who wants to process an MRI exam. Either they're going to be hospitals, individual doctors, research institutions, or probably clinical trial organizations. Our 5-year projections estimates that we break even in the 3rd year of our operation. Our competition, we have competition, indirect and direct one. Indirect are the companies that develop and manufacture MRI units, but also provide as a supplementary service non-advanced software platforms. We also have the software manufacturers, software developers, who can act also as exit plans of our company in terms of acquisition in the future. In terms of investment, at the moment we seek for a 100K initial investment. We want to finalize our product, file for the patent and the FDA. Then we need 300K in order to expand the exams of the software. R&D and sales will be another investment. And in 2017, we seek for a 1 million investment in order to focus more on the sales force and sales strategy. Where are we now? We have managed to have a fully functional prototype. We have manually conducting 50 exams. We are filing for a patent by negotiating with an attorney US agency in the US. And also we're optimizing the web interface by applying and conducting usability tests with 7 doctors. What was the MITF contribution, what we have done so far? Well, when we ended the program, we had the business idea, we had the algorithms, and part of the back-end software coding. But then, through the workshops, we managed to finalize the IP and patent strategy of the company. We optimized the business model and the pricing policy. We experienced and also excelled our pitching capabilities, and we created a really valuable network of individuals and also organizations. We participated at the MIT Bootcamp event, and we also expanded our network and had also a lead of Boston Healthcare Association, which is a future collaboration of us in the US in terms of business development. Our team is a diversified team in terms of R&D, technology, and business development, but also we need guidance in terms of advices, in terms of R&D, product development, networking, and also finance. So far, we have won some of the major competitions here in Athens. Innovation 2014, iBank being one of the 10 finalists of the Hellenic Entrepreneurship Award. Yesterday, we were one of the 11 winners of the Startup Bootcamp High-Tech Excel in Netherlands, in Eindhoven, and also were incubated by some of the most prestigious incubators in Athens. So thank you for your time and for your attention. I look forward for your questions.
Paris, great timing. Thank you. 5 minutes for you, gentle people.
Hi. So I understand very little about medical equipment and doctors and what they do. Can you explain us a little bit why is it so better than other solutions? I got the percentage, and why would the doctor use it?
Okay.
What's in it for?
Well, regarding the first question, our competitive advantage lies in the fact that we have a better methodology. It's part of our algorithm. It's part of our approach. And this is because the current solutions, they have a problem. They cannot counter a specific problem. You can see that nerves are linear. What they can do is that they're branching, they're kissing, they're like crossing. And the current solution, the current algorithms cannot see what it goes behind the crossing, behind the the kissing. So what they do is that they create mistakes, faults. It's like assuming what is going to be, or probably the 3D construction stops there. What we can do better is that we know what exists behind the crossing and the kissing and the branching. That's the whole thing that we have managed to encounter. But regarding to the usage part, well, we have other competitive advantage. We're cloud-based, so none of the existing software application is cloud-based. So we have flexibility in terms of the usage, in terms of the device, but also we have different service provision. We can attract small and medium hospitals and clinics who do not have capital resources to invest on per licensed software platform. What they can do is that they can purchase like volume of exams as like menus on a monthly basis, so it's easier for them and costless for them in order to invest on a software on like a yearly basis or 2 years, etc. So that's the plan of the business model.
Well, let me understand. Do you upload your software into the MRI scanner?
No. The MRI scanner and the workstation at the moment, they're totally divided, totally separated. The current status is that you apply an MRI scan, the information are being stored to the hospital servers, then you have a static workstation with a pre-installed software, and then you just open the exam, open the information, and you just do the processing with the existing software. In our solution, you have the information, and you upload it to our software as a platform. You do the processing, and then you have the results. Either you can download them or you save them on your profile. So what we do is that we give flexibility to the doctor in order to apply the processing from any device, either from his office or either from a static workstation if he wants, if he has an internet connection, on a client-based service.
Thank you, Paris.
Thank you.